I'm Dr. Dani Anderson. I'm a naturopathic physician and acupuncturist here in Portland, Oregon. Today we're working with my personal trainer, Andrea, and she's so good about helping me get my structure back in line that I decided I was going to help her today. She has this chronic shoulder issue, so kind of tell us what happened with this shoulder, Andrea.
Well, going back 15 years ago, I used to teach kickboxing, and it was just repetitive motion, and it was actually both shoulders different times. And then the last year, I had a little snowboarding incident on a real hard sheet of ice and just slammed, my full body weight. And so, through the years, there have been different times where I haven't even been able to raise my arm up. And so I've somewhat rehabbed it back, but there's still this constant tenderness, for lack of a better word, and then just this neck pain that plagues me on a regular basis.
Okay, so obviously I know a couple more things about her. So we already went through and tested this beforehand, and we're just going to show you how to get the structure aligned on this one. So the first thing that I do when I'm trying to assess, hey, where is this pain coming from, is I go and I test the actual muscle itself for evenness, okay? So we'll do it on this side first, but first I'd like to demonstrate something to you. Go ahead and stand up, Andrea. Turn around in the back. What you're gonna notice here is she's got great posture. What you'll notice is this shoulder is just slightly higher than this shoulder. And you can see that because my hands are kind of up. I'll try to get in this direction without blocking the camera. Okay, hopefully when we make this correction, we're gonna see this even out, okay?
Now, Dani, do you also notice, are my fingertips, does my left hand appear to be lower than my right hand?
Yeah, so this could be another way to assess it too, and that's absolutely the case.
Mm-hmm.
Just very slightly, because she's got really good posture. So go ahead and sit on the edge of the bench here, Andrea. Okay, so now I'm gonna test for muscle congruency. So let me have you bring your deltoid muscle or one of your shoulder muscles up here. I'm gonna press down about 20% of your pressure, resist what I'm doing, okay? That's nice and strong, okay? Let's check the other side. And this is the side where you're having pain.
Mm-hmm.
Go ahead and press up. Also nice and strong, but you'll notice there's a little bit of wavering over here.
Yeah, and I can feel it doing
okay?
this.
And she's already kind of pointed out to me where she's having the pain. I'm gonna go ahead and touch that pain area, and now I'm gonna press. And look at how this muscle weakens, okay? So before, what I did was I checked emotional involvement, which has to do with a reflex in Chinese medicine. That came back weak. So we went ahead off camera and dealt with any emotions that were attached to this shoulder weakness. We'll keep those disclosed. But we dealt with that, and now we're actually on to the structural piece of it. So this is why a lot of times when you go work with a regular personal trainer, or you go to another person like a chiropractor, they keep having to adjust the same thing over and over and over again. It's because a lot of times the body has emotions attached to certain injuries in the body. Traumas, maybe just trauma from the event itself of falling on that snowboard. So we released that, we cleared that, and now we're gonna go, hey, you know what? I know Andrea has a neck problem. Put this up here. Let's touch here and say, hey, if I adjust this neck in this direction, will this tighten up? And now it's nice and strong. Let me let this go. Whoa, boom. It falls right away. Push up, she can't hold this. And now I'll touch the spot of pain. She can't hold this either. I can really turn it off, okay? So now what I want is those muscles to be strong. So what I'm gonna do is I'm gonna locate the exact spot on her neck. So we've identified that it is probably in the C2 to C3 area on the cervical spine, so on the neck here. So let's test. Push up for me. This direction, no. It wants to go this direction, and we're right about C3, okay. So take a deep breath in, and I'm using a little activator tool, and this is an adjustment tool that as a naturopathic physician or a chiropractor you can use. Okay, so here you go. Take a deep breath in for me. Okay, and it makes a funny noise. And last one. Great. Breathe out. Touch here. Great. Touch here. Awesome. Okay, so now her muscle is actually locking, and that's what we want to see.